The Ministry of Health has shut down Chinsali General, Kalindawalo and Kazungula Hospitals as COVID-19 facilities. Announcing this during the routine COVID-19 updates Friday morning, Minister of Health Dr. Chitalu Chilufya says this has been done because the facilities have not recorded any cases of COVID-19 in the last 2 weeks.
Government has commenced shutting down COVID facilities that have not recorded cases in the last 2 weeks. This is informed by the numbers that have reduced, both at facility level and in the community. Therefore, we've closed down Chinsali as a COVID facility. We're closing down Kalindawalo Specialist Hospital as a COVID facility, Kazungula. We're closing those down, and all the leaders of public health at sub-national level should work in a multi-sectoral manner to identify alternative places in case of a surge.
But this poses a concern to the nation as other countries are now opening up their borders, a signal that there will be an increase of border traffic, especially in areas like Kazungula. However, the minister says the current window of low cases being recorded in the country will give the ministry some time to look for other COVID-19 facilities within the same area.
Where cases have gone down gives us an opportunity to establish dedicated facilities, free up the purpose-built hospitals to provide routine health services.
The University Teaching Hospital UTH COVID-19 Centre has also been shut down, with all 3 patients transferred to Levy Mwanawasa COVID-19 Centre. Director Infectious Diseases Professor Lloyd Mulenga says this has been done to allow other health services be offered to members of the public. Now, with only 17 COVID-19 patients admitted throughout the country, Professor Mulenga says this will give an opportunity to the healthcare system to direct resources to other needed areas.
What we have been seeing is a reduced number of cases countrywide. As of today, we have 17 in the various facilities, including some of the new admissions we had this morning. And of these, majority of them are in Lusaka. And we have also seen that a few of them are being placed on oxygen therapy. And following your guidance, Honorable Minister, that we should have facilities now toned down or reducing in the number of admissions and dedicating these isolation facilities to other routine services. We have moved on, like even UTH today, or the 3 patients who are in UTH will be moved to Levy.
Joining the update was Zambia Revenue Authority ZRA Board Chairperson Ambassador Bwalya Chiti, who handed over 12,000 bottles of hand sanitizer. The sanitizer was made from ethanol that the authority initially confiscated from smugglers.
The donation we're making today is as a result of our anti-smuggling efforts. We intercepted ethanol, 97% pure alcohol, that was smuggled into our country. And we then decided that we should use this ethanol wisely, and approached the private sector to see how we can work together.
In the last 24 hours, 2 deaths have been recorded. One is a death from Levy Mwanawasa COVID-19 Centre, while the other is a body that was brought in dead. 38 new COVID-19 cases have been recorded out of 3,842 tests carried out, with 74 recoveries also recorded.
Men and women, 38 new cases out of the total number of 3,872 tests that were done in the last 24 hours. And this includes cases that have been recorded in various parts of the country, including Lusaka, and unfortunately 2 deaths, 1 BID and 1 facility death involving a Chinese national at the Levy Mwanawasa Medical University.
Virginia Chilongo, Movie TV News, Lusaka.